In 2023, Tri-Cities resident Shane Leach sent a letter to the leadership of Ballad Health. In the letter, it described his wife's medical conditions, but it also had Ballad Health's mission statement: honor those who serve by delivering the best possible care. That letter was also sent to me. This is his story. For the past 24 years, Shane Leach has been by his wife Rhonda's side. Now he says he's living his worst nightmare.
It's fresh, and then it's also seems a lifetime ago.
A few years ago, Rhonda's health began to decline. Leach tells me they were in and out of Bristol Regional Medical Center at least 10 times last year.
Almost exclusively at Bristol Regional, because that's most of the time EMS had to come get her, and that's where they transport, is to the closest ER.
In October 2023, Rhonda was taken by ambulance to the hospital after she became confused, was vomiting, and had severe abdominal pain. Leach says she developed a gastrointestinal bleed.
And they did not have a GI, a gastroenterologist, available at Bristol Regional due to staffing issues. And they had no one that was willing to, I guess the general surgeon that was willing to even attempt whatever needed to be done to intervene for the acute GI bleed that she had. So they treated her as best they could. Again, doctors, nurses, all wonderful to work with, all very caring, very compassionate. It took approximately 12 hours to get her transferred to Johnson City. And by 9:30 that night, they had the bleeding stopped, is when I was told they had the bleeding stopped. So, but she never regained consciousness after that.
Rhonda passed away a short time later.
Yeah, she had a lot of life left to live, I think. And now it's gone.
Leaving Leach with a lot of questions, including what if Bristol Regional had a GI doctor available that day?
If you are having an acute bleed, had they addressed it at 10 a.m. instead of 8 p.m., would it have made a difference? And would she still be here? Yeah, I think it would have made a difference. Absolutely.
I asked Ballad Health CEO and President Alan Levine about why Bristol Regional Medical Center was not staffed with a GI doctor. He says the GI group that handles those types of situations are independent physicians that cover each hospital.
Holston Medical Group hired one of their doctors away. Two of their doctors became seriously ill, I think a stroke and cancer if I'm not mistaken. And then Holston Medical Group hired a second doctor from that group. They all of a sudden had they were 40% down in their doctors in their practice. And so they gave us 9 days notice that they were resigning from the medical staffs of the 3 hospitals because they themselves could personally no longer cover all the call. Holston Medical Group's GI doctors aren't on the medical staff and have never been.
Levine says now they've hired physicians called locum tenens GI doctors to provide coverage, and Ballad is investing nearly $1 million to provide that kind of care.
None of this had anything to do with Ballad. I mean, none of it. We're the ones that had to step in. The fact that we have GI coverage at Bristol and Holston Valley now is because of what we're doing. If we did nothing, there'd be no GI doctors there. So it's because of our relationship with the GI group in Johnson City, where we went to them and Dr. Ross pleaded and said, we need your help. And you know, this is a good example of why you don't want rural hospitals to fail, because similarly, if a rural hospital fails, all of that burden falls on the hospitals and doctors that are left. This group in Johnson City, which has always covered Johnson City, they never signed up to cover Johnson City, Bristol, and Kingsport. Imagine the load on them. So we're very fortunate that they understood the problem and were willing to help.
I checked and I learned the notice letter from the GI group was dated in April 2023. 6 months later, Shane's wife had her GI bleed and GI doctor shortages continued.
I think our healthcare in the region is suffering. It goes without saying that I don't think we're better off necessarily. from the merger.
Levine says there's also a national shortage of gastrointestinal doctors. According to the U.S. Bureau of Labor Statistics, between 2022 and 2032, there will just be a 3% job growth in gastroenterology. 50% are 55 years or older, so nearly half are expected to retire in 2 decades. The Virginia Hospital and Healthcare Association says there's a shortage of physicians across the Commonwealth, and rural communities are hit the hardest. They say just 1 in 10 physicians nationally work in rural areas. For Shane Leach, the reasons why will not fix his tremendous loss. He's just trying to live a new life without his wife, and it's especially hard because he's a Ballad Health employee.
I want to be proud of where I work. I absolutely do. And I can't say that I am right now. I'm not. I'll say it. I don't want to say it, but that's just the short end of it. I want to be proud of my employer. You want to be proud of your employer. I don't want to work somewhere that's causing more harm than good.
This is just part 4 of our series that examines Ballad Health since the merger. Be sure and join us for more on News 5 Monday at 6.